What's going on, everybody? Dr. Vasquez here, trying to give you a quick introduction to today's video. So in today's video, after I get back from a late lunch, is going to be on the topic of pharmacology. So hopefully some of you remember a few months ago I created a new acronym for pharmacology, and the acronym is very easy. In fact, the word for the acronym is easy, either in English or Spanish. So in English the word would be facile, ending with an E, and in Spanish the word would be fácil without the E at the end. So, you know, the more that we learn and the more that we study, the more organized we have to be with our ideas for the sake of quality and detail, but also for the sake of just being efficient, because, you know, by the time a person or you, or in my case me, by the time we've studied, you know, however many topics, we need to access that information in a way that's organized so that it's complete every time that we do that, not just kind of shooting from the hip. Although, of course, it's sometimes we have to do that. So after studying and teaching pharmacology for quite a while, and thinking about it and experimenting with different acronyms, I finally came up this year in 2024 with the acronym FACIL. The F stands for function, so you would need to know the function of whatever treatment you're using, or the vitamin, or the mineral, or the amino acid, or even drugs. So this applies across the board for a wide range of therapeutics. So again, the F stands for function. So let me just say one more thing. A good acronym should be easy to remember, maybe have a little bit of redundancy in it, because redundancy helps us be safe when we're trying to do things that are important, especially in clinical care. And it should be in a logical sequence. So for me, this is a sufficiently logical sequence. So when I'm thinking about a therapeutic, I'm first and foremost thinking about what it does. So that's why I started this with F, because the first thing that we think about is function. Second, the A would be either administration or application. You could kind of go either way. The application would be more precise to the diagnosis or the clinical scenario, whereas administration would be more apt for being precise with the dosing. So one of those words is looking at the disease or the condition, and the other word is looking more at the drug itself. So you could kind of pick whatever you want, or maybe use both, or use them interchangeably. So again, the F is for function, the A is for administration or application. The C is for, again, could be for a couple of different things. It could be context, it could be contraindication. I'm trying to think of what I used it for most recently. I think it was caution, actually. So caution or context or contraindication, but again, you know, any fool can write a prescription. What makes a doctor or a clinician good at their job is not so much that they do X, is that they know when not to do X. So that's why you'll see in this acronym it has a little bit of redundancy, and each one of those redundancies is for detail and caution and a little bit of a pause to not use the right treatment in the wrong setting. I personally have used and like using the letter I to stand for interactions. So, you know, a lot of times we see patients and we might be thinking of their condition, but what we need to also think about is how that intervention could interact with either their disease or other drugs that they're taking. So I use the I to stand for interaction, and specifically drugs and diseases. I suppose you could also look at interactions, again, with the context of, is the patient about to go into surgery? Are they going to be bedridden for a certain amount of time? In which case you would either want to use or not want to use, something that has like an anticoagulant effect. And the L stands for laboratory. So a lot of times we do pre and post monitoring, or maybe we don't, for example, with vitamin D. And this is actually relevant, so I think this is a point worth making, especially since I'm going to talk about vitamin D in the first video. So you'll notice, for example, first of all, let me just clear out that thought. And the thought is that with vitamin D administration, you really don't need to do lab tests before, in the vast majority of cases. The reason that statement is actually important in this context is because if you look at the Endocrine Society recent guidelines, they talk about the quote-unquote confusion caused by using laboratory tests, and we don't know how to interpret them, and we don't know if it's the right test, and all this bullshit, because they're intentionally trying to clusterfuck the entire topic, which they have done so to the level that it should be considered a crime against humanity. So you'll notice again that what the Endocrine Society did is they said basically we should ignore the topic of vitamin D because the laboratory testing is too complicated. Well, I have a solution for that. It's called ignore the laboratory testing, at least to get started. Most people in the Western world, or actually most of the world, period, most people are deficient in vitamin D. So you're not going to find a person who's, vitamin D toxic unless they're taking already a lot of vitamin D. So a reasonable presumption is that they're either normal or deficient. So, having that background knowledge liberates one from the obligation to engage in the entire conversation that was the stumbling block for the Endocrine Society. So again, they clusterfucked the entire topic of vitamin D by saying, well, we don't know how to interpret the labs. Well, if you have enough context and knowledge, which they should have had, and I'm sure that they did have, they just chose to ignore their own data, including on COVID. So the way to get around that is just to know the topic. And if you know the topic, then you know that most people are deficient. People don't become spontaneously overloaded on vitamin D, even if they're sunbathing on a regular basis. So, only on rare occasions would you need to test someone before implementing the intervention that most people actually need. And if you do so, wisely and appropriately, then you're going to be fine. The E, if you want to use the English version, so again, facile in Spanish has 5 letters, facile in English has 6 letters. So if you want to use the E, you could say employment or exceptions, and again, that would just provide you another caution. I just noticed something on the fence right next to me, which I'm going to take a quick break because this is kind of funny. So yesterday I was out running. I decided to see if I can train for a half marathon. And so yesterday I went for a big run. And as I was running, I saw on the sidewalk, totally randomly, like this audio cassette tape, like the actual tape, not the container of the cassette. And so I'm sitting here looking at this fence. I hadn't even noticed, but it actually has audio cassette tape, like hanging from the fence. I'm presuming it's audio cassette tape. I just find that funny, So back in my Generation X, this is how we listened to music, was audio cassettes and lectures. I listened to a lot of lectures on audio cassettes. And so I was kind of fascinated. I almost stopped and took a picture of it yesterday, which is, I'm trying to train myself to not take so many pictures. But I saw this audio cassette tape strung out on the sidewalk, and I thought, wow, that's so random. And then here it is again on this fence in this park. Anyway, so I hope you're all doing well. What I'll do later today, I already have it set up, is I'm going to kind of walk through using the acronym I'm going to start with vitamin D, and then I'll do vitamin A and vitamin E and vitamin K, and then I'll do the other vitamins. So I think it'll be a worthwhile exercise, and hopefully for the enjoyment of most of you, or at least some of you, it'll be a good way for me to, engage on a clinical, nutritional, biochemical topic, and maybe talk a little bit less about the social disaster that the Western world is now becoming, which of course takes a lot of my attention. So, and for good reason. So for example, let's assume, accurately in this case, but let's assume that I'm an expert in vitamin D. And let's assume that vitamin D is relevant for depression, autoimmunity, infections, allergies, dysbiosis, cancer, heart disease, etc. Let's assume that I'm an expert on something that's important. Well, the way the world's going, and the way the world has gone, is that I'm at risk of either being censored, blocked, or penalized for talking about my own expertise in the topic of vitamin D. So, I already had established expertise on antiviral nutrition, which is a concept that I can't say that I totally created it, but I certainly gave it structure. I published that book, Antiviral Nutrition, back in 2014, and then it was banned by Amazon in March of 2020 at the start of the pandemic. So the point is, we're at a point now in the so-called Western world, or mostly the English-speaking Western world, and Europe for that matter, where experts who are legitimate, hard-working experts. I'm not just a Facebook expert. I worked my ass off for years to develop expertise in a lot of different topics. And I developed that expertise. Iron overload, whatever, diabetes, fibromyalgia, migraine headaches, a lot of different conditions. And I did it the old way, which is actually reading articles and reading books and cross-referencing and making diagrams, and then sitting on it for a while and making sure it all makes sense, and then publishing it in journals, and then, to kind of test my ideas and things like that. I mean, that's how and lecturing internationally. I mean, that's how real experts develop, maintain, and establish their expertise. So again, I have expertise in a lot of different topics. But the way the world is going because of this political bullshit, I'm at risk of being, censored, blocked, like on Amazon. They took down most of my books just because I talk about nutrition in the treatment of viral infections. So, I'm guessing that some people think, oh, well, medicine, nutrition, functional medicine, chiropractic, naturopathic medicine, I should just talk about medicine. Well, I would like to just talk about medicine if the world wasn't so fucked up right now. But because of the political situation, they're filtering and blocking people who have legitimate expertise on these important topics from even being able to talk about them. So, I was kicked off of LinkedIn because I talked about vitamin D. I didn't even say anything radical, but they deleted my entire profile. I think I had I don't even know, and I don't really care, but maybe I had 8,000 or 10,000 so-called followers. I used to have 40,000 on Facebook, and now my Facebook account gets blocked every time I use it. So I can log into Facebook, I can see one or two messages, I might be able to post something, and then I'm blocked. And then I have to verify that I'm a human, I have to verify my identity, I have to use my phone or my tablet or the computer, and they receive a message and verify your credit card information. I mean, I have to do so much shit on Facebook just to use it that I don't even use it anymore. Let's see, I've been blocked. I have a couple of accounts on YouTube. They're all separate, but I'm shadow banned on YouTube so bad that sometimes I can't even find my own videos. And I've noticed, because I created a different account from a different country, because obviously I started a YouTube channel maybe, I don't know, whenever it started, 15 years ago or something like that. But I noticed that with my original account, If I upload a video, it takes forever, hours, because they have it on a slow server. On my relatively new account, I can upload the same video in 5 minutes. So I'm definitely, shadow blocked and shadow banned on a lot of different platforms. And that's not because I'm doing bad work. It's actually the reverse. So the better and more accurate my work is, the more I get banned, because I talk about how this is bullshit, and I talk about how you've got options, and they don't want you to have options, and they don't want you to know it's bullshit. And so, part of what distracts me away from engaging in the science that I know and love is that talking about it has negative consequences in a lot of different platforms. So, that's why we all have to be aware of the political situation that we're in, because it does affect all of us. It affects me as a speaker, and it affects you as a listener. So that was my, see how many minutes? 16 minutes. I suppose I've rambled on for enough time. I'm gonna go get lunch, late lunch, and then go tour the metro system in this wonderful city that you can see behind me. So hope you're all doing well, and I will try to get these videos online as soon as I can. Thank you much. Take care. Bye.